You believe that this are recommendations that can bring about change?
Every day in Scotland, 3 people die from a drug overdose, and those are shocking statistics. Each death is a tragedy, obviously, for that individual, but for their loved ones, their families, for the wider community, and for all of Scotland. Changing Lives, our report, says what needs to be said and identifies what we need to do to reduce the number of drug deaths. Changing lives is a message of hope. We don't believe that the situation is hopeless. We believe that change is possible, but also change is necessary, and that's the strong message from our report. Changes in public attitude, changes to how services are delivered, but we believe that the Changing Lives report will make a real difference to the lives of many people in Scotland.
Now, people might say 20 recommendations, we want change. You say even in the report this needs to happen at pace. What deadlines are you placing on that for action from these recommendations?
The report is very comprehensive. We've got 20 overarching recommendations and 139 specific action points. Each action point has been given a timescale, either short term, which is 12 months, medium term, 1 to 3 years, or long term, some of the cultural issues for 5 years. We have our final recommendation is that the Scottish Government should produce an action plan within 6 months detailing exactly how these will be implemented. One of the biggest changes we want to see is a removal of stigma and discrimination. Too many families and people who use drugs find that they are not treated on a par with other health conditions, and we're very clear that addiction is a health condition. Addiction is not a crime, and you can't punish people out of addiction. So what they need is support and treatment and care, and it should be available at the moment and in the place where people need it.
But 6 months, how do you turn that around? A culture change and a system change within 6 months?
Well, the 6 months is to produce the detailed action plan, and we recognise that something like a culture change will take years because it needs training the workforce and generally tackling those occasions when people are treated with discrimination and criminalised when they actually need care and support and treatment. So you're right, that culture change will take longer, and that's why the work of the task force, while it's been going for 3 years and has now produced its report, clearly the influence of what we've done will continue over the next few years.
The task force hasn't been without its critics. Many people would say it's taken 3 years to get to this stage, to say what they have already been saying right from the very start, that there's been a lack of money, a lack of investment, people aren't being listened to. How would you respond to those critics today who say, well, this is just all a complete waste of time? You're telling us what we know already.
Well, the task force has already had an influence. It's funded research projects, it's funded some innovative projects and pilots, and those right across Scotland have been implemented, and there's been lessons learnt from that, and there'll be more lessons to come from the research and those pilots 2023. But since the task force was started, the drug deaths in Scotland has been declared by the First Minister a public health emergency, a public health crisis. And what our report is saying, that statement needs to be turned into action. We need to take seriously that shocking impact of 3 people every day in Scotland dying from a drug overdose, and put in place the actions that we are recommending so that that number will be reduced, that people will get the treatment and the care that they deserve, not the stigmatisation and criminalisation. You
say in the report that the level of funding at the moment is woefully inadequate. The government have already pledged £250 million. What level of funding do you think is needed?
The point about resourcing is that this is a significant change. We're saying that this is a major challenge for Scotland, and it needs to be funded. The reason I think that we describe funding as woefully inadequate because of the cuts from 10 years ago that have just about been restored to those levels. But what we are saying realistically, if you are going to make a sea change here and implement these recommendations, then there will need to be additional resourcing, and that has to be the Scottish Government's commitment, where they've signed up or they've commissioned a task force to come up with recommendations. They now need to fund the recommendations in the report.
more additional funding to the 250 million that's already?
Well, we haven't done a detailed analysis of cost, but some of these things are about changing practices that may not take a lot of money, but other things, particularly residential rehabilitation, stabilisation beds and so on, may take additional resources. But one of our strong recommendations is about the need for leadership. So we're talking about clear and strong leadership at both a national level and at a local level, because that's how you affect change, so that local leaders, whether in local authorities, health boards, the integration joint boards, will have responsibility to implement their plans locally, because drug services need to be responsive to local needs. How
do you make that happen? Because at the moment we know that alcohol and drug partnerships are failing to meet the standards that are already set out for them. The Scottish Government has said, Angela Constance just a few months ago said that they really need to deliver on that. Do you agree that they're failing to deliver, and what do you set out?
So the task force developed MAT standards, the medication assisted treatment standards. They were introduced last year, and Public Health Scotland did a recent review of their implementation, and there are big gaps there. And we have said in our report that those 10 MAT standards must be implemented within the next 24 months. So it would take a significant investment. It'll take training and time to implement those. So the MAT standards are one thing, but we're also recommending generally for addiction treatment services that there should be standards, there should be guidance, and they should be inspected. So just like other health conditions where there are clearly laid out standards, people know whether they've been implemented or not and met, and that there's public reporting of that for accountability. We're saying that addiction services should be exactly the same. There should be clear standards so that people know what to expect. There should be measurement of whether they're achieving those, and some sort of public reporting and inspecting of to what extent they are being met.
They would say at the moment they don't have the money, they don't have the staff, and 2 years, if it's not been achieved in the last 2 years, how can they do it in the next 2 years?
Well, the MAT standards only started last year, so we had 1 year, and we're saying that they should be given 2 years to do this. Resourcing is an issue. We've said that needs to be implemented and funded. But also, you're right about the workforce. So there are challenges, and part of, I think, the stigma associated with addiction services, and it links to mental health, is that often they're seen, they're not valued as much as other disciplines in medicine. And there is a challenge for recruiting, training, and retaining appropriate staff who have the right attitude and the right skills to work in addiction. So you're right that too is a major part of our report, is needing a workforce strategy to meet the needs of the recommendations.
Does the current national strategy that's in place, is that not fit for purpose at the moment, according to your recommendations?
The Drugs Deaths Taskforce was looking at one specific aspect, which was trying to reduce the number of drug deaths, and we believe that implementing our report will lead to a reduction in drug deaths. But we also talk about some of the wider strategic issues, saying there needs to be prevention, early intervention to tackle some of the underlying causes, and obvious ones are structural inequality and poverty, which are features of so many people who lose their lives to drug death. So things like that need to be as part of the national mission, the national strategy, and so they need to deliver on that as well as on the drug deaths.
So currently, does it fall short, the national strategy?
The fact that 3 people a day are dying from a drug overdose says that Scotland is failing to respond successfully and adequately to the drug deaths crisis that we have. And it's not just about health, it can be to do with housing, homelessness, it can be to do with unemployment, it can be to do with mental health, it's to do with poverty, educational failure. All of these are linked in. You can't just isolate drug addiction from the whole life of a person. And that's what we say in our report, that there needs to be a person-centred approach that doesn't label them as a problematic drug user or as someone with mental health problems or a homeless person. You need to look at them in the round, and I think we are failing at that, and that's what needs to change.
What would you say to people who would say, yet again, we've just got more words? What we really want is action?
Well, a report inevitably is words, because that's what it is, and I'm speaking to you in words. But the product of this report is action. So we've laid out very clearly 20 overarching recommendations, which talks about having people with lived and living experience and their families at the centre of it. It talks about leadership, it talks about a lot of detail, and 139 action points. And so these words describe action points, but the focus is on action and on implementation and on monitoring and public reporting so that we can be sure that these recommendations will be implemented.
You came into this just with 6 months and you spoke to, I presume, a lot of different people and a lot of different groups. Are you telling them today, I've listened to what you've told me?
The work of the task force, I mean, there are 15 people on the task force, but we have engaged with hundreds of people and listened carefully, and this is a product of that. And absolutely, we have listened to what people have said. And actually, at the heart of this is that authorities need to continue listening to people. People with lived and living experience, their families know what it's like. We talk about the role of peer mentors, peer supporters, navigators, and the vitally important role of recovery communities, not just as a sort of extra, picking up the pieces where things fail elsewhere, but actually being at the heart. Because often someone who's been on a recovery journey will say that what made a difference was having one person, a peer, a mentor, a supporter, who walked with me on that journey and knew what it was like. So all of this, while we're talking about big strategies, has to focus on the individual and on their lives and on their journey. But
for too long, the third sector would say they've been picking up the pieces, have been filling in the gaps, and really at the heart of it, as your report shows, that they're being failed by lack of leadership at a higher level.
Well, the third sector play a vital role. They're not just filling a gap that should be filled by a statutory service. I mean, they often have a different ethos, a different approach, and often recruit and employ people with a different background, and that can be really valuable. So informal support networks, third sector, as well as statutory services, all have a really important part to play. And what we're saying is that they need to work together in a new way, taking a health, public health approach so that we can get the real results that we need.
Next week, we'll have the latest statistics that show the death toll and the tragedy suffered over the last 12 months. Do you believe the report that you've prepared gives a basis for change in future years in those statistics? Next week, yet again, we'll have much more outcry at what will be undoubtedly very high figures.
I think it's significant that we're publishing this report this week in advance of next week's official drug death statistics for 2021. And this is the basis. This can be the response to what will be a continuing crisis, that there will still be, whatever the number is of drug deaths for last year, those will be too high. And what we need to see is a sustained reduction over the next 5 years in the number of people dying from a drug overdose. And we believe that this report, if implemented, will contribute to reducing the number of people dying from a drug overdose.
And finally, one other aspect you raised was supervised consumption facilities. You do believe that could be part of a strategy and a solution?
We make recommendations about the introduction of supervised drug consumption facilities, not on their own as a kind of magic solution, but as part of a treatment option. It improves the health of people using drugs. It also is an opportunity for them to be referred into treatment services. One of the best protective factors for someone who's using drugs is that if they're in support services and in treatment. And therefore, if someone is able to use a supervised drug consumption facility, that's better immediately for their health, but it also might lead to additional support and help them on the road to recovery.
But there continues to be barriers from the UK government in that respect. Youth and the Scottish Government at the moment are looking at ways of getting over those barriers.
So our report makes recommendations about changes to UK legislation, But we also recognise that we need to act now, so we can't wait for that. And therefore, we're saying that the Scottish Government should be exploring options of how these can be facilitated. And I know that the Lord Advocate and the Crown Office have been helpfully looking at how it could be that the use of supervised drug consumption facilities can be implemented.